8 minutes. That's how long 40 critical patients had when the hospital's main power and backup generators both failed during a winter storm. 8 minutes before ventilators stopped, monitors went dark, and the cardiac wing became a death trap. But Nurse Sarah Martinez had trained for worse odds than this. Much worse. Welcome to Silent Warriors. Before we continue with this incredible story of courage, training, and hidden warriors, tell me in the comments from which city you're watching today. And if you believe stories like this deserve to be told, hit that subscribe button. We're revealing the stories of invisible warriors among us. But before we dive into those 8 minutes of chaos, you need to understand who Sarah Martinez really was. Because the quiet night shift nurse wasn't who she appeared to be. Sarah Martinez looked exactly like what she was supposed to be, a 42-year-old experienced nurse. She'd worked at St. Mary's for 13 years, always preferred the night shift, never complained. Patients loved her, calm, competent, never panicked even during the most stressful moments. Her colleagues called her the Ice Queen. Not in a bad way, just because nothing ever seemed to rattle her. Heart attacks, respiratory failures, sudden code blues. Sarah moved through all of them with the same steady composure. No one ever questioned why she was so calm. They should have been grateful. Because before Sarah Martinez was a nurse, she was Sergeant Martinez, U.S. Army 68W combat medic. 3 tours in Afghanistan, 2 in Iraq. From Kabul to Kandahar, she'd practiced tactical medicine in the hottest zones, started IVs while bullets whizzed overhead, saved lives in the aftermath of bomb explosions. Sarah had converted her military medical training into a nursing degree to transition to civilian life. But the battlefield training never left. If her colleagues at St. Mary's knew Sarah's background, they'd understand why she never got scared. A hospital was paradise compared to a field hospital under fire. There was electricity, running water, abundant supplies. And nobody was shooting at her. Sarah specialized in trauma and critical care nursing. She preferred night shifts because the most critical situations usually happened at night. And Sarah loved critical situations. She'd been trained to control them. On the night of February 13th, as a winter storm battered the city, Sarah began her normal shift routine. The cardiac wing had 40 patients. Most were elderly post-cardiac surgery, dependent on ventilators, fragile but stable. At 2:45 a.m., when the storm hit the power grid, Sarah's Afghanistan training would activate again. The first power outage was handled with normal protocols. The backup generator automatically kicked in. All systems continued running. Nurses exchanged knowing glances. Routine situation. Hospital staff were used to these kinds of outages. But 2 minutes later, the backup generator failed too. The sudden silence was terrifying. Ventilators stopping, monitors going dark, life support systems suddenly going quiet. Except for the red glow of emergency lighting, the hospital wing was plunged into darkness. And then the panic began. Other nurses started screaming. What do we do? Where's the generator? The patients are going to die. Sounds of running in the corridors, radios going silent, phone lines not working. Sarah didn't move. She stood for 1 second, listened, assessed. 40 patients, 23 dependent on ventilators, 12 with heart rhythm disorders, 5 requiring life support systems, no backup power. Main electricity could take hours to restore. Fire department and emergency services would be delayed due to the winter storm. She'd handled worse situations in Afghanistan. But then there was only 1 casualty. Now there were 40 patients, and they were all about to die. Sarah formed a tactical plan in her mind. Battlefield medicine principle. Distribute resources to save the most lives. Available medical supplies, manual ventilation bags, portable defibrillator, battery-powered, emergency medications, manual suction device, human resources, 4 nurses, panicking, 1 secretary, 1 security guard. Time, 6 minutes remaining. Sarah's voice echoed down the corridor. The command authority in her voice instantly cut through the other nurses' panic. Jennifer, get the crash carts now. Maria, collect the manual ventilation bags. Rebecca, sort the patients by priority triage. No one questioned why Sarah was giving these orders. The authority was so natural that everyone moved. Because at that moment, it wasn't Sarah Martinez anymore. It was Sergeant Martinez, and Sergeant Martinez was trained to save lives. Sarah's first move was triage, the fundamental principle of battlefield medicine: distribute resources most effectively. Red tag requires immediate intervention, salvageable patients. Yellow tag can wait but needs close monitoring. Black tag, save others rather than consuming resources. There was no such system in civilian hospitals, but on the battlefield, this was the only way to keep most people alive. In the next 6 minutes, Sarah would make 9 critical decisions. 7 would save lives, 2 would change her forever. Sarah identified the most critical patients, those completely dependent on ventilators. They could be kept alive with manual ventilation, but it required constant hand pumping. Jennifer, manual ventilation for this patient. 12 breaths per minute, steady rhythm, don't stop. At the same time, Sarah ran to another patient. The heart rhythm monitor wasn't working, but pulse check detected arrhythmia. She applied cardioversion with the battery-powered defibrillator. Clear! Electric shock. Heart rhythm returned to normal, but there were still 37 patients. Sarah was moving like she was on a battlefield. Multiple casualties, limited resources, time pressure. But this time, there were no enemy bullets. While Maria prepared emergency medications, Sarah gave epinephrine injections to the most critical patients to support heart function. Rebecca was clearing airways with the portable suction device. 4th minute, Sarah realized some patients could breathe briefly without manual ventilation. She redistributed resources. Maria, these patients are priority 2. Focus on those needing manual ventilation. 5th minute, one patient went into cardiac arrest. Under normal circumstances, it would be a 15-minute CPR procedure, but Sarah restarted circulation with heart massage in 2 minutes. Battlefield CPR, fast, effective, without neglecting other patients. 6th minute, Sarah made the hardest decision. 2 patients needed manual ventilation simultaneously, but there was only one bag. First patient, 78 years old, post-cardiac surgery, other comorbidities. Second patient, 34 years old, post-traffic accident, young and strong. In civilian medicine, they would try to save both. On the battlefield, resource allocation had to be logical. Sarah made her decision. She focused on the younger patient. 7th minute. The power came back. A sudden burst of light, systems restarting, monitors suddenly making noise. Ventilators began working, life support systems returned to normal. But Sarah didn't stop. For the 8th minute, she checked every patient. Vital signs stable, ventilator settings correct, medication doses appropriate. After 8 minutes, 39 of the 40 patients were alive. They had lost one patient, the elderly patient she'd been forced to choose against. But under normal circumstances, if the power hadn't returned, probably 15 to 20 patients would have died. Sarah stood in the middle of the corridor, wiped her hands on her pants, and tried to breathe normally. But the other nurses were looking at her differently now, Sarah noticed. Sarah, Jennifer approached, her voice slightly trembling. How did you do that? You acted like you'd been through this before. Sarah hesitated. She'd been avoiding this conversation for 13 years. Experience, she said simply. What kind of experience? No one responds to crises like that. You acted like you had military training. Sarah noticed the other nurses were listening too, the security guard as well. They'd survived the night, but now there were questions. Hospital director Dr. Patterson arrived an hour later. While taking the night shift report, he was shocked by what he heard from the other nurses about Sarah's performance. May I ask how you managed to keep 40 patients alive, Nurse Martinez? Sarah was alone with Dr. Patterson in the office. The doctor was serious but not accusatory. He was curious. I applied battlefield medicine principles, Sarah finally said. Battlefield medicine? Yes, sir. Resource allocation in multiple casualty situations, priority determination, rapid intervention protocols. Dr. Patterson frowned. Where did you receive this training? Sarah was silent for a long time. Then she pulled an old faded ID card from her pocket. Military ID. Sergeant Sarah Martinez, 68W combat medic, 5 tours of duty. Dr. Patterson examined the ID. The photo was a younger Sarah, in uniform, with a serious expression. Why did you never mention this? Because my military background wasn't necessary for my civilian nursing, and most people don't understand. Tonight you saved 39 lives. Under normal circumstances, this wouldn't be possible in such a crisis. You have special training. Sarah nodded. I worked multiple casualty situations in the field, limited resources, maximum impact. Tonight I applied the same principles. But there was one more thing Sarah didn't mention. About the hardest decision she made that night. As Dr. Patterson closed his file, he asked, "You lost one patient, Mr. Morrison, 78 years old. What would you recommend we tell his family?" Sarah's face hardened. This would never be an easy conversation. Tell them the truth. When the power went out, it was impossible for everyone to survive. We had to distribute our resources to save the most lives. You've made these kinds of decisions before. Yes, in Afghanistan, after multiple IED explosions, 5 casualties, 2 ambulances. You have to decide who to transport first. Dr. Patterson was silent for a long time. You shouldn't have to make such decisions in this hospital. But I did, and 39 people are alive. What Sarah didn't know was that this night would change everything at the hospital. The following week, Sarah received a special offer. Hospital management had created a new position, emergency coordinator, for someone with battlefield training to train other personnel in similar crises. "Sarah, we need people with your kind of experience," Dr. Patterson explained. "Tonight you showed that military training can save lives in civilian life." Sarah hesitated. "This means sharing my background, and it means saving more lives in the future." When deciding whether to accept the position, Sarah talked with her daughter Emma. Emma was 19, a medical student. She knew about her mother's military background, but not the details. "Mom, I saw you on the hospital website today. It says hero nurse. What happened?" Sarah told her about that night. The power outage, 40 patients, 8 minutes, difficult decisions. Emma listened quietly. Then, "Mom, you're a warrior. In the hospital and on the battlefield. I just did my job." "No, Mom, you did what a warrior does, quietly, without complaining, making hard decisions." That night, looking in the mirror, Sarah saw herself as both nurse and warrior for the first time in 13 years. Sarah Martinez now works as both a nurse and emergency coordinator. She trains hospital staff in resource management during multiple casualty situations. There's a new plaque in the cardiac wing. February 13th, 2024, 39 lives saved, with respect to silent heroes. Sarah still prefers the night shift, but she's no longer hidden. Her colleagues call her Sergeant, with respect. Dr. Patterson's words always stay with her. "Sarah, you're not just a nurse, you're a warrior, and this hospital needs warriors like you." In recent months, Sarah has responded to 3 different emergencies: natural disaster, mass poisoning, and hospital fire. Each time she applied the same principles: stay calm, distribute resources, make hard decisions, save lives. 8 minutes. That's how long it took to keep 40 patients alive. That's how long it took for a warrior's training, hidden in civilian life for years, to surface. That's how long it took to prove that real heroes don't need uniforms. Sometimes they carry stethoscopes. So I ask you, who are the silent warriors in your community? Who are the people with extraordinary backgrounds who step up in crisis moments but remain invisible on normal days? Share their stories in the comments. Help us honor the warriors living among us, quiet and humble, waiting until the moment the world needs them. Because here at Silent Warriors, we believe the most powerful stories belong not to those on battlefields, but to warriors in hospitals, schools, protecting people's lives every day. Thank you for watching. If this story moved you, subscribe and share it. Help us prevent these silent warriors from staying silent. And remember, the person working beside you might be the one trained to save your life.